Fantastic. And you heard a lot about CeraVe. First of all, can we just have a round of applause for how fantastic our mentees are? What they've accomplished over the past year and where we know this is just the start of these projects and where they're going, to me, is just mind-blowing. And I think they know that once they've been they're part of our family, you're always part of our family. I think none of these mentoring relationships are ending. Everyone's very connected and attached. So we're just so proud of all of them and all the work that they've done. And with that, I want to say a huge thank you to CeraVe, who has gone with us on this journey really for all 5 years. Tom was with us at our very first meeting. And so I will let them introduce themselves, but it's been a great journey to have your support, and you could hear how much it's really impacted all of our mentees. So thank you so much. The floor is yours.
Thank you so much for those kind words, and it's really a tough act to follow these amazing mentors and all the great work they're doing, but we are super thrilled. This is 5 years in the making, kind of what we're going to announce today, and that's our brand cause, which is called Care for All. And my name is Tom Allison. I'm one of the co-founders of CeraVe. What I do for the business actually is I run the professional marketing. So think about interacting with physicians, figuring out the clinical studies, the new product introductions, that kind of thing. And then Maud's going to follow up with really a lot of the details on what our sponsorship will look like with GLODERM, but we are super thrilled to be here. To bring you back a little bit of history, one of the secret sauces, if not the most important part of CeraVe, is it's developed with dermatologists. We take it very, very seriously. It's actually part of our logo. I don't know if you've ever seen that underneath the name. To add context to what does develop with dermatologists means, it was the dermatologists that we worked with that point us in the direction of using physiological lipids like ceramides, for example. They also pointed us in the direction of using a pharmaceutical type vehicle called multivesicular emulsion. So if you take those two technologies, the name CeraVe is established because of our dermatologist interactions. It's safe to say that if we didn't have dermatologist partners like you, we wouldn't have a brand. So it just made a tremendous amount of sense that if we were going to do a cause, that it had to be to fuel the passionate dermatologists that are trying to change the world. When we look at our kind of brand purpose and brand cause, our mission is always to provide therapeutic skin care for all. Our belief is that everyone has a right to healthy skin. This was part of the journey to help us figure out what should our brand cause and what's the statement we want to make. And that's to make dermatologists accessible to even the most underserved people around the world. And it's easy to see that the work that the mentors are doing are more than doing just that. Obviously, I don't need to talk about this in this room. Skin health matters to all. This is research, I think, that came out of your group, is that 3 billion people lack access to dermatological care. And we know if we can train physicians, provide dermatological service and infrastructures, as well as quality care and education, basically it's your care and our fuel can help make dermatologists accessible to underserved communities around the world. And we'll do that by empowering, train, and support dermatological caregivers in underserved communities. So thank you so much once again for all the mentors. You guys have really set the bar high, so best of luck for those to follow. But we are super inspired every time that we interact with this group, and we fully believe and are fully committed to a long-term partnership with GLODERM. And what I'm asking you to all do is challenge us to rise to your levels of support so we can make a difference around the world. So now I'm going to bring up Maud to walk you through what CeraVe and GLODERM are going to do.
Hi everyone, my name is Maud Guérin and I'm leading the Care for All program for CeraVe, and I'm also leading with Jehara the GLODERM partnership. And so I'm really, really excited to be here today, and I might be as emotional as Esther because you don't know, but I know all your names for the mentees. With Jehara, we know all your stories, and I can't tell you enough how inspired we are and honored to be here today with you all. And I would say, to really take a first step in this Care for All mission, I think it makes total sense for us to partner with GLODERM. And we love what you are doing. We love this alliance of dermatologist changemakers, the fact that you are an alliance of passionate individuals who are really driven by the missions to increase skin health access. And so our role, as Tom said, is really to empower you, train you, help you wherever in all your different steps to scale your impact. And so that's why with GLODERM, our common goal has always been to train, support, empower the next generation of dermatology change makers. So we've been along with Esther and the GLODERM team to really spearhead the mentorship program, the GLODERM training program. And I would say that we are proud that our contribution went a little bit above simple financial donations. We've really tried to put our skin in the game. And for instance, in the training part, we led 3 different workshops, part of the 12 different workshops led by GLODERM, to really try to communicate and give you back our knowledge in terms of communication skills, media training, leadership skills, etc. So, and really, Jahara, I can't tell, and I hope you can meet her, but she really helped us throughout the journey. Also, we are super proud about the empowerment. We gave 2 grants for career development for 2 mentors and dermatology change makers in this room. And the objective is to really enable them to have more time, more resources to do what matters, in fact, and to really increase access. And lastly, Dorian, you mentioned it, but finally, after 3 months of working due diligence, we made it happen. So we've been able, and really the products are now leaving to your country. But we have finally donating 3,600 mineral sunscreens to your project, and it's really please, as Tom said, keep challenging us, and we really want to support you and be by your side. And so it's really interesting to find out how difficult it can be to fly product there. But we really don't want to stay we want to go further, basically. And we have discussed also with Esther and with GLODERM how we can really help you throughout this journey. And so we have 2 announcements today that we wanted to share with you. The first one is that we will be able to give for the mentors, the mentees, free Visual DX Derm Plus licenses that Lorna will help you to go through and better understand. And really the objective is to give you the tools to help empower and to... No.
What a smile.
No, exactly. No, it's a fantastic tool, and really Lorna will tell you more about that, but we are excited about supporting you in that matter. And the second element, we wanted to, after this amazing first year of a mentorship program, to give you access to Access Grant. And after all this amazing project, how can CeraVe financially help you to move forward and really make concrete action and impact? So first, a deep dive, maybe Lorna, you want to join me on stage, but we have this amazing partnership with GLODERM, CeraVe, and Visual DX, and the objective are 2 things. It's to really help you to train and support your frontline caregivers working in underserved communities and support them in their dermatological clinic decision. The second element, we do believe that by doing so, we will be able to pioneer global health dermatology and get a better understanding of the skin conditions among underserved communities. So Lorna, take the stage to tell us more about Visual DX.
Thank you, Maud. It's so nice to be here with you all today. I started at Visual DX when I was an Albright Fellow at Wellesley, and now I work to lead our partner innovation in the global health, public health, and life science space. Our CEO and co-founder, Dr. Art Papier, he's very sad he can't be here today. He told me he's got to keep the bosses happy. And I said, who, the board? He goes, no, my wife and daughters. So he's super sad, but he's got to keep them happy over there. And so I want to standardize everyone's understanding of what Visual DX is and the especially special programming that we put together with GLODERM and Maud. So I really want to thank Maud and the GLODERM for hunting us down at AAD a short 4 months ago, and I'm so happy that we can present something tangible to you today. And so Visual DX, Dr. Papier and Dr. Goldsmith founded it in 1999, over 24 years ago now, and we're a clinical decision support system. So everything that the mentees were talking about that are issues, those are problems that we want to address. Enhancing that diagnostic accuracy, aiding in the therapeutic decisions, and also improving the patient safety. And so Visual DX can be used a couple different ways. You can build a differential diagnosis with clues, or most dermatologists use it by looking up diseases to engage the patients. There's 46,000 medical images in there, and so it's any disease that presents visually, we have an icon image for. And then in our machine learning platform, there's also more than hundreds of thousands medically vetted images that inform that. And then almost a third of our images show patients with dark skin. And so that's been a priority of Dr. Papier and Dr. Goldsmith since the beginning of this health equity, of how different diagnoses look different and depending on the amount of melanin. And then users of Visual DX can review that expert information and then also know what to look for, what are the differential diagnoses, the best tests and therapy options. And so at the point of care, we hear from dermatologists all the time, you have X amount of time with a patient, and then you need to see the next patient and the next patient after that. So we're trying to create speed and accuracy through visualization. And it's through visual pattern recognition. We not only have those dermatology images, but we have medical illustrations, symptom icons, radiology images, pathology images, and other dermoscopic images as well. And so what's super exciting is there's a feature on Visual DX called Derm Expert that allows the user to take a photo, and it runs against the hundreds of thousands of medically vetted images that we've trained our machine learning on. And it presents the user with the top 3 lesion types of what it thinks it is. And then that paired with clinical informatics information that the user will answer as they go through, it gives them an exhaustive differential diagnosis. And so I can imagine this will be especially helpful for those frontline healthcare workers. We know there will never be enough dermatologists, and by empowering with this, it can really help. This also, Maud said she thinks she can be a dermatologist now using this. And so we've been building this knowledge database for over 24 years and have international Visual DX users. So I won't go through all these stories, but I'll send this deck out afterwards to get a sense of how it can be used. And then for those frontline healthcare workers, we can also change the language and where you're practicing so that it's personalized through that way. And so getting into the toolbox of what we specialize for the GLODERM mentors and mentees, we're taking a 3-step approach. There's a learn, practice, and deep dive, and there's different tools in each of those sections. And so in the learn, we want the mentees to be able to educate the frontline healthcare workers at a scalable level. So it's not typing out the same lecture and sending it around. Like, we want to be able to give you materials that you can disseminate at a large level. And so we have a fundamentals of dermatologic diagnosis, which is about a 60-page PDF, and it's translated in multiple languages now, and it'll be available on our landing page. And this is just standardizing the understanding of Dermatology 101. And then what I have with me today, I have these Learn Derm pocket reference cards. And so this is an opportunity, again, for the mentors and mentees to distribute them throughout their communities so that frontline healthcare workers can start enhancing their interactions with patients. And then in the practice toolbox, we have the licenses that you're able to give out. And so the use case for this is that you can use this at the point of care either to engage with your patients or help those frontline healthcare workers get to the right diagnosis through the differential. And then in the deep dive toolbox, which will give us some measurable data, we can have the users of Visual DX start to quiz themselves on dermatologic cases so that we can measure the impact of this education. And then we're also developing Learn Derm courses, which are interactive. They'll also be translated so that frontline healthcare workers can complete the 5 lessons to test their new knowledge from the program. And so I will be here all week. Art is available. And then we're also lucky to work with Dr. Mbiale. He's our Global Health Information Officer who also leads our Gates project on NTDs. So thank you so much for having me. I'm so excited to roll these out.
Thank you so much, Lorna. So concretely, what is happening, what we offer from both the mentors and the mentees. So each mentors from cohort number 1 and cohort number 2 will have access to the Visual DX trainings and the free Visual DX licenses. And the GLODERM mentees cohort number 1 and 2 will have access to the Visual DX training, 1 free Visual DX license per year, and on top of that, the opportunity to give up to 150 free licenses to your community. So Dorian, I know, for instance, that you are working with 60 medical students, and so the objective is really to empower and to scale. So that was an idea from, obviously, Esther, from GLODERM, from Visual DX. So once again, just to tell you how committed we are and how we really want to help you, empower you, and help train your teams and to make a greater impact. Maybe you can applaud. Another thing that really GLODERM is pushing us to do is like, okay, after 1 year, these mentees, now they are fully prepared, but they need like resources, financial resources. So this is why we came up with this CeraVe Access Grant, with the opportunity for each mentee to apply for $20,000 a grant to support their community work and increase access to dermatological care. The details are work in progress, but just wanted to really announce it and to say that it really will happen by end of this year. And lastly, just for us this week, just for you to know, it's a very big week because it's the first time after 18 months working with GLODERM that we are finally announcing Care for All for the dermatologist community in WCD. So very interesting for you to know. Please come visit our booth. It sounds a bit commercial, but really we want you to come. We want to film because we have a dedicated session of Care for All. And you will see there is an amazing interactive map where all the 30 mentors and mentees have been like captured and there. And so you click, you have like your ID card that has been made, some quotes, and you signed all the legal stuff to be there in this booth with us, but really to tell you that we are with you. And please invite any other changemakers to take a survey because we want to recruit new changemakers. We want them to be on that map that we obviously share with GLODERM to really build a stronger community of dermatology changemakers and a bigger network. Lastly, there is an amazing opportunity. We have an Agora TED Talk where like a few mentees are about to present their work in the L'Oréal Village. So please come. And lastly, it's not on this slide, but there is a symposium on Thursday during lunchtime. It's about AD and skin of color. So please come. You are more than welcome, invited. It's a free lunch. I don't know. Okay. And lastly, there are some key people in that room. You can definitely take a picture of this one, but they're like all CeraVe LDB division people that are here that are really willing to meet you. We want to partner with you. And so please take a picture, come to see us. And we might be shy. I know you think you are shy, but we are shy because you are so impressive, guys, on what you are doing. So that's it. For us, just wanted to say bravo for what you are doing.
Well, a huge thank you. I know I'm seated right here at a table of mentees, and when they found out they were getting 150 free licenses to give out to everyone, there was a lot of joy in Whoville, I will say, at my table. So I want to thank you, and in particular with CeraVe, I think what's been really incredible for us is it's been a real partnership, and I've spent a lot of time, as they know, on the phone with them, and I like to say, that's great, but I think what you really want to fund is this. And they've just been so incredibly willing to work with us, learn with us, and I think they've shaped our direction. I think we've shaped their direction. So I have to say it's been really an incredibly positive experience for us, and we're so excited, and we're so excited that they're giving our mentees additional access to funding for all of this incredible work that you've been doing. So thank you for that huge announcement today, Iman.